For many women, the pain of uterine fibroids or adenomyosis is more than physical. The real difficulty is hearing a doctor say, maybe a hysterectomy is the only option. That means no more periods, no chance to have children, and an indescribable sense of being incomplete.
Over the years, the idea is for us to remove the fibroid. So, removal of the fibroid, you would need to suture the area, which will leave a scar. That was the practice for fibroids. For adenomyosis, the problem is always, even if you remove the area of the adenomyosis, it is difficult to suture it back. It is like suturing guava, there's this grittiness that it is difficult to close back the uterus.
A training workshop on women's health is taking place here. With microwave ablation, there's no need to remove the uterus. A thin needle, guided by ultrasound, reaches the lesion with precision. The heat destroys the diseased tissue, which the body then absorbs.
I witnessed a workshop being held, and it showed how you can burn fibroids and adenomyosis with minimal scar tissue to the organ. So that was very impressive.
Minimally invasive is micro-invasive, so there's barely any incision or barely any scars on the abdomen if you're doing it percutaneously or if you're doing it transvaginally. Patients tend to have very minimal pain and they can even go home on the same day.
No large cut on the belly, no loss of the uterus. The procedure takes about 30 to 40 minutes. This isn't future technology, now it's happening here.
So the advantages are more in terms of shorter operation time. Number 2, less bleeding. Number 3, you can preserve the uterus because risk of uterine hysterectomy is very low. Okay. Number 5 is shorter hospital stay, and number 6 is reduction of symptoms and the size of fibroid comparable with the traditional surgery.
In April 2026, the Level 1 Micro-credentialing workshop on microwave ablation brought together doctors from different countries from theory to hands-on practice, and then to real cases.
I think the hands-on workshop was very useful because that's when you actually get the idea of the whole procedure itself. Just listening in theory or looking at slides would not be enough. So the practical workshop was very, very useful.
Level 1 micro-credentialing is just the start. Standardized training helps more doctors master this technique safely and effectively.
We are not in the business of trying to convince people. What we want to do is to make sure that you understand the actual biophysics to therapy, teach you how to do it properly.
And once you start doing your surgery, a proctor is important. So you need to have a proctor with you, especially for the first few cases, to help to build your confidence and to improve patient safety as well.
I must say, Canyon is friendly and Canyon has good after-sales service. They're quite attentive to our needs and they actually listen to what the doctors want to bring up and what are our issues, and they try to make it better. And I think the collaboration that is I'm impressed with is the fact that they are also interested in the development of the training process and not just trying to sell their instrument.
All this technology, all this training, ultimately for one person. The woman sitting in the hospital room. When she leaves, she takes back her body intact and her confidence.
Stay hungry. So never be complacent. There are always new techniques to learn.
Canyon Medical, with doctors worldwide, preserving choice for women.